10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon. Thanks for staying tuned into our YouTube channel. My name is Matt Law with Health Benefits Associates, and welcome to Mastering Medicare. Earlier today, we had a live broadcast with Grant Dodge in our office, who interviewed Dr. Pezanowski about pancreas and other diseases, and that was through our Hello Health series, which has been a very fun and exciting series we've brought to you to link you up with doctors and healthcare in the area. Today and right now, we're excited to present to you Mastering Medicare, where experts like myself bring you the top tips and tricks you need to know when finding the right Medicare plan. And guess what? The Medicare annual enrollment period starts exactly a month from today. So I recommend you get your notepads out, some pens available, maybe some popcorn, because we're going to learn a lot and we're going to have a lot of fun at the same time. Now let's go through a few things before we dive into today's presentation on the expert tips you need to know to find the right Medicare Advantage plan. First off, this YouTube channel has obviously a lot of live presentations on it, but also a lot of interactive and fun videos available to help you learn more about your healthcare. If you want to learn more and you want to stay up to date, I recommend hitting the subscribe button on this YouTube channel so you can be notified when we go live or have another video for you. Our office is also located throughout Northern Nevada. We have many different locations and we have many Medicare advisors ready to help. We have offices in Reno, Sparks, and in Carson City. I'm currently in our Reno office, but if you ever want to come in and ask questions face to face, you can always schedule an appointment with us and our Medicare advisors would be happy to help. We're here through the whole process and we don't charge any fees. So if you have a Medicare question or need help finding and enrolling in the right Medicare plan, come on in and we'll make sure to help. So let's go through a few things for the video today, or the presentation if you will. Just like Hello Health, we've had a live Q&A through these live broadcasts and we've had a lot of good questions come in. Today we're going to have the same thing. If you have any questions about Medicare, make sure to leave them in the comments section below this video. And at the very end of the presentation, I will get to them one by one to make sure you become a master of your own Medicare. So at any time, leave a question. You don't have to wait until the end to ask a question. It can be any time. I'll just be answering them at the end. Now, in the middle of today's presentation, we have something really special, and we've been working on it for a while. We have a video that we actually posted on our Facebook last week describing a very complicated situation with Mary Sue. Mary Sue is in a conundrum with her Medicare, and after today's learning, we're going to put your knowledge to the test to see if you know what Mary Sue should do in her situation. And we're going to watch that video and get your answers in the next 10 minutes or so. Now, before we dive into the basics, or into the expert tips of Medicare, I want to go through a few basics. First off, Part A and Part B. If you have a Medicare Advantage plan today, you already know about Part A and Part B. But did you know that you could have Part A and Part B before you turn 65? Now you have to have a certain disability to qualify for it, but most people will qualify at 65 and enroll through the Social Security Administration. Having Part A and Part B is what qualifies you for plans like Medicare Advantage. So if you're looking at getting a Medicare Advantage plan, make sure you have the red, white, and blue Medicare card in your wallet, and it should say Part A and Part B on it, and if it does, then you're ready to go shopping. If you need help learning about your eligibility for Medicare's Part A and Part B, or how to enroll through the government, click on the link in the description below this video and it'll take you to our website where we have more information. Now, once you have Part A and Part B, that is just the beginning step in the process. You need to ultimately figure out what plans you qualify for. And that's really determined by where you live. So there are certain parts in this, or certain places in this country where if you want to get a Medicare Advantage plan, they may not be available. And you need to make sure that when you're shopping for plans, your home address will ultimately dictate your eligibility for different plans and programs. You can talk to a Medicare advisor like us at Health Benefits Associates, and we will help you navigate this complex market. And don't worry, if you don't have a Medicare Advantage plan in your area, there are always alternate options like MSAs or Medicare supplement plans. There's a whole wide array of Medicare plans. But for today, we're going to be talking about Medicare Advantage and what's available in your area in Nevada. The other thing I want to talk about is that not every Medicare plan works for every person. So it's not a one-size-fits-all. I get this all the time. People come into my office and they say, my friend has this plan F, or I have this Medicare Advantage plan that I absolutely love. You've got to have it. Well, I'm sure it works great for them, but it might not work as well for you. And this is where today we're going to go through the ins and outs of all the things you need to check off your checklist to make sure you find the right Medicare Advantage plan. So just know that talking to a broker or a Medicare advisor is probably the way to go, so they can go through all of these check boxes with you to make sure it works. Now let's dive into the expert tips of how to find a Medicare Advantage plan. There's a few things we're going to talk about today. First, we're going to talk about value-based care. Then we're going to talk about doctors, prescriptions, and the unknown, also known as healthcare logistics. We'll have a pop quiz in the middle with Mary Sue's situation, and then we'll wrap it up with extra benefits on Medicare Advantage plans. So let's start with value-based care. Value-based care is a very important concept to understand when it comes to Medicare Advantage. Value-based care takes three components in play. It takes you, the member, most important. It takes your doctors, the people that you see for healthcare, and the insurance company you select. Now, value-based care, what it means is that all three components, you, your doctors, and the insurance company, work together to efficiently and effectively treat your conditions. Let's talk about your doctors really quick. Your doctors are going to treat you, and ultimately, if they treat you correctly, they're going to save you money. I threw up a graph here on the screen so you can better understand the savings that you will experience on a Medicare Advantage plan. Traditional Medicare spending was $1,253 lower for beneficiaries who switched to Medicare Advantage in 2016. Now obviously it's not 2016, and these Medicare Advantage plans have really become stronger in coverage than they were many years ago. So I would expect this savings to be even greater. So if you're someone who's on a Medicare supplement plan or just on Medicare's Part A and Part B and you're wondering, well, is a Medicare Advantage plan going to save me money? Statistically, from the Kaiser Family Foundation, many people save over $1,000 over the course of a year on a Medicare Advantage plan. And that's all thanks to the doctors you work with. Your doctors, which include primary care, specialists, maybe even the lab facilities you go to, they all communicate together to create one coordinated effort to keep you happy and healthy. So it's a team effort, and you don't really see that on a lot of other healthcare plans. If you're on a different type of Medicare plan that's not a Medicare Advantage, you may get the feeling that you're on this endless carousel of healthcare, where you're going into the doctor, you're going back out, you're going back in, and you're just endlessly going in, but don't really know the reason why. Well, it's probably because other plans do not have the same value-based care model. But why do doctors and insurance companies want to promote value-based care? Let's go through a few things, and this is a legislative perspective. So your doctors, through the Medicare Prescription Drug Improvement and Modernization Act of 2003, doctors received increased payments across all areas. What that means is that Medicare Advantage plans and how they reimburse doctors was actually increased, and the doctors have actually gotten better favors or better reimbursements from the insurance company since 2003. So they are actually encouraged to keep you happy and healthy and treat you efficiently and effectively. This is why we're going to see a lot of Medicare Advantage doctors accept new patients, which if you live here in Northern Nevada, you know that this is a huge issue that we're all dealing with today. Getting into the doctor sometimes takes months, or finding a doctor that doesn't accept you at all, doesn't accept new patients. If you have a Medicare Advantage plan, this may be a completely different story. So keep that in mind, that not only are you saving money, but your doctors are being reimbursed correctly through this expanded system with Medicare Advantage. Let's talk about the insurance companies. Through the Affordable Care Act, there was a new system of bonuses to compensate plans with high quality ratings in 2012. Well, what does that mean? That means that if the insurance company can prove that you are being treated correctly and that you are actually going in and getting your treatments to get healthier, you can actually make the insurance company receive more money from the federal government. So, to wrap it up, value-based care. It's all about the three components: you, your doctors, and the insurance company. And the beauty of this is, from a legislative perspective, it's bipartisan sponsorship. Both the left and the right, for once, actually agree on promoting and expanding Medicare Advantage. So I actually think if we talked about this 10 years from now, a lot of these numbers will actually be much stronger than what they are today. And if you've actually looked at the numbers, which I have, since in 2019, they did a study that shows that Medicare Advantage plans have nearly doubled in enrollment. So from 2009 to 2019, you can see this uptick in the metrics. I expect this to further increase on this trend. So if you're considering Medicare Advantage, not necessarily, I want to make sure that you understand that it might not be the right plan for you, but it's looking to be the right plan for most people in America. Now that's value-based care. That's more of the history of Medicare Advantage and the future and where it's going. Now let's take a deeper dive into the aspects that you need to focus on, which are your doctors, your prescriptions, and the unknown. First off, you want to shop for a plan based on what you know, but also look into your crystal ball and shop for things based on what you don't. So let's take a deeper dive into this. These are things that, as a Medicare advisor, I am checking off the list every time I sit down with someone who wants to talk about Medicare. And the first pit stop I take is your doctors. Those are the most important piece. That's the most important piece of the puzzle. The places you go for healthcare, like your doctors, your specialists, radiology facilities, hospitals, those are all things you want to make sure are covered on the Medicare Advantage plan you're shopping for. Each Medicare Advantage plan will have a network list that you need to search, and if you want to get the best out-of-pocket expenses, you need to make sure those doctors are in network, also known as being contracted with the plan. Now, some of you, and most of you, are probably taking prescriptions. You also want to make sure that those are covered by your plan. So each Medicare Advantage plan has a formulary. And if you looked at these formularies like I have, they are extremely long. They can be 200 pages long. So you may not want to look through that yourself. You can just come to a Medicare advisor like us, and we will troll through those booklets to make sure your prescriptions cost the right amount and are covered correctly. Now, when you take your doctors and your prescriptions, you also have probably some treatments in play as well. And so this is where I want to use myself as an example. That's me in the hospital, waiting for a surgery that I wanted to do for my entire life. I don't know if you know this, if any of my clients are watching right now. You've probably heard me talk about how I've had sleep apnea. That's me in the hospital bed getting sleep apnea surgery. The road to getting into that hospital bed was not short. And that's where, as a broker, I actually shopped for plans for myself based on not just the surgery, but the whole process leading up to it and the process after the surgery. So if you're someone who has major treatments or major surgeries on the horizon, take a 10,000-foot view. You're not just shopping for plans that cover the actual treatment, covering everything pre-treatment and post-treatment. But there's also things that we can't account for, and those are your risks. I'm going to use myself as an example again. I like to use myself as an example. This is where I am a skier, and I think I'm a pretty good skier. However, I may have a bad day on the hill in Tahoe. And I may fly off the hill and need to go to the emergency room. If that's the case, I'm probably looking at an MRI, maybe a surgery, and an ER bill. I hope that doesn't happen, but I need to choose a plan that covers it as if I think it will happen. So if you have lifestyle choices that give you higher risks in certain situations, or you have the risk for a health condition that may come up, even if you don't have it today, you want to make sure you shop for plans during the Medicare annual enrollment period each year based on what you think may or may not happen in the upcoming year. So those are things in Medicare, especially for Medicare Advantage plans. You want to look at it as a year-by-year analysis. And just know that it's not always the things that you can account for, but sometimes the things that are what-if scenarios. Speaking of what-if scenarios, we have a really complicated situation. And this is that video that I was talking about. We're going to show you a video where the main character, named Mary Sue, has a very complicated situation. And if you're a Medicare advisor like myself, you know that these situations come up on a daily basis, and the tricky part is there may not be one right answer. So I want you guys to watch this video and understand that there are going to be multiple answers at the end of the situation. I want you to think about what you would do in Mary Sue's situation. We're going to put that to the test later and actually get your answers after the video. But let's tune into Mary Sue and see what she's dealing with today and how we can solve it. Well, looks like we had some technical difficulties and the audio didn't come through. So this is where I'm actually going to tell you the situation, and I want you to think about what Mary Sue should do. So Mary Sue has a cardiologist, and she really needs to go to the cardiologist. But she's shopping for Medicare Advantage plans, and her cardiologist does not accept any Medicare Advantage plans. So we're trying to figure out what should Mary Sue do, and there's a few different paths that she can take to resolve this situation. And I want you to really think about that. If you were someone like Mary Sue who goes to the cardiologist, this is where you need to go, and you need to make sure you can see them. But you also don't want to break the bank when you're going. So what would you do in Mary Sue's situation? So we're going to go through the potential answers, and what I'm going to have you guys do is read through these answers and think about them. And when you think you find the right answer, I want you to type the number of the answer below in the comment section. So for example, if you think option 3 or answer number 3 is correct, I want you to type in number 3 in the comment section. I'm going to have my team calculate based on your answers and the answers we received on Facebook over the past week to see what you guys think is the right thing for Mary Sue. Now, like I said earlier, and I'm a little bit tricky like this, but there might not be one right answer. So really think about it. If you have multiple answers you want to vote for, put both numbers down. But I'm going to give you guys some time, and I'm going to read these answers out loud so you can think about what Mary Sue should do with her cardiologist, who does not accept any Medicare Advantage plans. Answer number 1, look at Medicare supplement plan options. Answer number 2, stop going to the cardiologist. Answer number 3, get a PPO Medicare Advantage plan. Answer number 4, get an HMO Medicare Advantage plan. Now I'm going to leave these answers up here on the screen so you can still read through them. I'm going to give you about a minute or so to really think about it. But anyone who's tuned in now, I want you to take your best guess at what you think Mary Sue should do. And I'll come back in a few minutes. All right, you guys, just a few more seconds here. I can see that we have some people voting in right now. Make sure that when you're voting for the correct answer that you think Mary Sue should do, just type the number in the comment section below and hit enter. And I'll make sure to go through all of the answers and explain what's right and what's wrong. Right, I think we're going to wrap it up here in a few seconds. As always, if you're in a situation like this, like Mary Sue, that, obviously these situations come up on a daily basis. If you're confused about Medicare or what situation or what you should do in your situation, just remember, Health Benefits Associates can help you determine what course of action you should take by sitting down with you and helping you with your Medicare options at no cost to you. We have offices here in Reno, Sparks, and in Carson City. You can also just call us on the phone. We'll be more than happy to help. All right, so it looks like I got the answers from our team members who are taking advantage of the polls through the comment section. And this is where, let's go through it. So Mary Sue and her cardiologist, what should she do? Answer number 1, look at Medicare supplement plan options. Looks like we actually got the most votes on this. We had 3 today vote for Medicare supplement. This actually is a correct situation. So I wanted to throw a little curveball in for you guys. Even though we're talking about Medicare Advantage, just know, like I said, Medicare Advantage is not always the right fit. However, this is a big however, the last thing we talk about in today's presentation really is not covered well on Medicare supplement plans. So in this situation with the cardiologist, Medicare supplement plans is definitely viable. However, once we finish this presentation, you might be thinking twice about Medicare supplements as an option. Answer number 2, which is stop going to the cardiologist. Well, good news for everybody. We're all correct on this. No one voted for answer number 2. If you have a cardiologist, I highly recommend continuing to see them. And Mary Sue should definitely do the same. Answer number 3, get a PPO Medicare Advantage plan. We had 2 people today vote for this. This is also a potentially correct solution. PPO Medicare Advantage plans have in-network benefits where doctors can contract with them. Mary Sue's cardiologist does not contract with this plan. However, out-of-network benefits are available on PPO plans. So when you're going out of network on a Medicare Advantage plan, you will still get some coverage from the insurance company. Might not be great, but it will be covered, and you will have a maximum out of pocket out of network. Answer number 4, get an HMO Medicare Advantage plan. We had a handful of people vote for this, and this is where this is an incorrect answer. HMO Medicare Advantage plans only include in-network benefits. So if Mary Sue's cardiologist is not contracted with the plan, well, the HMO plan is just not going to cover it at all because there's no out-of-network benefits unless you're in an emergency situation. So to wrap it up, if you answered numbers 1 or 3, those are definitely correct solutions if you are a Medicare advisor trying to advise Mary Sue on what she should do. But let's dive into the last part of this presentation, which, like I said, it may make you think twice about Medicare supplement plans as an option. And it's called extra benefits. Extra benefits are a whole body health experience. It also saves you money in areas where you may not think that you could get some savings. And extra benefits sometimes can come in the form of better access to doctors as well as assistance with your health care. Let's take a deeper dive into extra benefits. I know that those are all fluffy words, but let's get down to what extra benefits look like. Extra benefits can come in the form of dental care, and not just basic cleanings. We're talking comprehensive dental care. There's also vision care, where if you need glasses or eyewear, those will sometimes be covered by Medicare Advantage plans. Hearing aids can also be covered by Medicare Advantage plans. And if you know how expensive hearing aids are, you know that shopping for a plan that covers them can be very valuable to you. OTC, you'll see this on the screen. OTC stands for over the counter. And this is where a lot of insurance companies will actually cover vitamins or first aid kits, cough medicine. They'll actually reimburse you to go get them and fill your medicine cabinet. There's also care coordinators on some of these plans. And care coordinators are people that can help you navigate the complex world of healthcare. And so if you're trying to plan a treatment like we were talking about earlier, you can get a care coordinator who will actually walk you through the steps of everything that needs to get approved so you can get your surgery. And if plans include those, they usually include it at no cost. Now, what we're seeing also here in Northern Nevada, which is very, very important to understand, is that certain Medicare Advantage plans will have exclusive facilities available to you. Meaning, if you have a Medicare Advantage plan, there will be certain medical facilities that you can only get in their front door with if you have a Medicare Advantage plan. So if you're tired of waiting long wait times at the doctor's office or just finding a doctor that accepts new patients, the exclusive facilities can really mitigate that problem. Now, I talked about it. Medicare supplement plans, they have a very big drawback that they usually don't include these benefits. So if you're someone who's really trying to get a whole body health experience, Medicare Advantage is probably the way to go. And just know that not every Medicare Advantage plan includes these extra benefits. So if you need one of these extra benefits or more, it's always important to shop your options every year during the annual enrollment period so you know what's available. But most Medicare Advantage plans include this. We have another exciting graph to show you that basically shows you that most Medicare Advantage enrollees have access to some benefits not covered by traditional Medicare. And in 2019, you can see that most Medicare Advantage plans include a dental benefit, a fitness benefit, and vision benefit. So if you're someone who needs to make sure that you don't have any fillings, crowns, or root canals, or you like going to the gym, or you need a new set of glasses, if you have Medicare Supplement or Medicare Advantage, you may want to consider your options with Medicare Advantage. All right, so those are the expert tips that I have today on how to find the right Medicare Advantage plan. I want to open it up to you guys through the Q&A so you can ask me any questions you have about Medicare Advantage. And I see that we have a handful of questions, and I'm going to go through them one by one. And as a reminder, if you have questions, you can leave them now. You don't have to wait, and I will get to them as they come in. So let's start with EP. Do you think that any of the newly designed Advantage plans are better than Plan G? Okay, that is a very good question. It's also, like I said, very circumstantial. A lot of these Medicare Advantage plans have factors that make them very appealing. They have the extra benefits. They can get you in the doctor a little bit quicker. You can get into doctors that you can't get into on a Medicare supplement plan. So depending on what your specific needs are, Medicare Advantage plan may be the way to go. It also depends on where you live in the state of Nevada. So Plan G, which a lot of people have the Plan G, and I definitely recommend the Plan G for a lot of people, really comes down to their specific situation. So once again, one of the first things I said, Medicare is not a one-size-fits-all. But I will say that every year it is very important to shop your options to see if your Plan G is getting the most for you. So EP, if you have questions about Medicare Advantage and to see if it's maybe a good option for you, I recommend reaching out to us so we can schedule an appointment and talk about your options. Suresh asked a question. He says, Matt, I have watched some series. I'm assuming you're talking about Hello Health, so welcome back. Looking forward to seeing you in open enrollment. Cool. Thanks, Suresh. Don't forget to schedule an appointment so we can sit down at one of our office locations. Owen has a question. I have a plan named Plan F, which for everyone watching, a Plan F is a type of Medicare supplement policy, and it has a lot of advantages. Is this a Medicare Advantage plan? Okay, so I guess I just answered that question. So a Plan F is not a Medicare supplement plan. Plan F used to be the most popular Medicare plan anyone could find in America, and a lot of people still have the Plan F today. However, the Plan F is going up in premium every year, and it's going up dramatically. So the Plan F used to be very popular. It has a lot of advantages, like no out-of-pocket expenses. However, if you're looking at your monthly premiums and you're comparing it to these new Medicare Advantage plans in the market, you may realize that the Plan F was good at one point, but today might not be the right fit for you. Looks like Bethy has a question. I thought Medicare Advantage plans just covered doctors in town. What do I do if I'm traveling? That is another really good question. Medicare Advantage plans, they kind of get a bad rap. So Medicare Advantage plans, a lot of people think that you have to see doctors in town. If you're traveling, you're in trouble if something comes up. Medicare Advantage plans will cover emergencies nationwide, and on some plans will cover you internationally at a copay. So just keep that in mind, that traveling, you shouldn't be concerned about that. Even going to the urgent care on a Medicare Advantage plan, you're usually going to have nationwide access to urgent cares if you're traveling in the United States and potentially internationally. There's also Medicare Advantage plans, like the one we talked about in Mary Sue's situation, that are classified as PPO, meaning that they will have a nationwide network of facilities that you can choose from and go to in-network. So just keep in mind, there's a bunch of different flavors of Medicare plans, and don't just think that you're stuck with the doctors you have. You're actually, on Medicare Advantage plans, usually getting a very robust list and robust access to facilities, even if you're traveling. We have another question coming in from Ron. How does the VA and Medicare Advantage plans work together? Great question. So the VA and Medicare Advantage can actually work together depending on your eligibility for veterans coverage. There's TRICARE for Life, CHAMPS VA, and just standard VA coverage. If you have just a VA card and you're able to get into the VA facility, you can get your prescriptions there, you can see doctors in there, and they do really good work. However, if you're not getting care at the VA, let's say an emergency room visit, your VA coverage is not going to cover you outside of the VA. If you want to get spectacular coverage outside the VA with doctors and specialists or dentists or emergency room coverage, this is where you can add on a Medicare Advantage plan with your VA coverage, and they work side by side. They don't hurt each other having both at the same time, and you can use them seamlessly depending on where you're accessing care. So if you want to learn more about VA coverage or TRICARE for Life or any of these levels for veterans and how it works with Medicare Advantage, give us a call and we will chat about your specific situation and what you're trying to accomplish from a healthcare perspective. We got a few more questions, and keep them coming in. These are actually really good questions. Matt, please explain the value care again. Does my supplement include this? So Matthew, no. So Medicare supplement plans are traditionally just medical plans. So this is where you'll get very strong medical coverage, but if you're looking for dental or vision or hearing aids or over-the-counter supplies, Medicare supplement plans usually don't include these. This is where if you really want to get access to these things or hearing aids, you really need to look at Medicare Advantage plans, since that is a major component of the coverage that's included with most insurance companies. Not all insurance companies, but most. All right, another question. EP has another question. Medicare seems to be paying most of everything. Why do I need a Medicare Advantage plan or a Medicare supplement aside from vision and dental? Yeah, that's a good question. So I think EP is talking about Medicare Part A and B. So having just Medicare's Part A and Part B through the federal government, in general terms, gives you 80% coverage towards your medical services, leaving you with 20% out of pocket. The problem is there is no maximum. So if you just have A and B of Medicare, if you get a $100,000 bill for Part B services, you're paying $20,000. I know I wouldn't want to pay $20,000. I don't have $20,000 laying around. And so this is where having a private Medicare plan, whether it be Medicare Supplement or Medicare Advantage, you are now getting a maximum out of pocket, which prevents you from going bankrupt. And also the other stuff like dental and vision on Medicare Advantage plans. Suresh has another question. I really like my Medicare Supplement Plan G right now. Do you think I need to switch? Keeps costing me more money. Okay, well, Suresh, once again, these plans, it's specific to your needs. I'm not going to tell you that a Plan G is wrong for you, but I do think it's right to shop for plans each year during the Medicare annual enrollment period, which starts on October 15th and it ends on December 7th. So if you need help assessing what type of policy is going to give you the most bang for your buck, I recommend coming in and we can chat about it. Medicare Supplement Plan G is great, but Medicare Advantage, as we've seen from the numbers, they're becoming more and more popular. Okay, I think we have a few final questions. Owen, is dental extra? How much does it cost? Well, dental actually on Medicare Supplement plans, you can actually find a Medicare Supplement plan that includes dental, but you'll see in the fine line it usually costs you some money per month to enroll in. Whereas Medicare Advantage, you're usually just getting dental bundled into the Medicare Advantage plan at no extra cost. Some do charge you an extra premium, but those are things you want to look at deep in the benefits of the policy to figure out what you're getting and ultimately how much you're paying for it. Those are things that we can help you with. I think we have 2 more questions and then I'll wrap it up for the day. I think I've given you guys a lot to chew on. Edward is asking, Matt, how do I schedule a meeting with your company? Well, that's easy. That's probably the easiest thing of the day is you can give us a call or send us an email. Our contact information is in the link of the description of this video, and you can schedule an appointment at one of our offices throughout Northern Nevada. You can sit down with me or one of the other many Medicare experts we have here at Health Benefits Associates. Okay, still Scotsman, don't some supplements include extra like vision and dental? Yes, that is true. So I can't say that all Medicare supplement plans do not include dental and vision. However, not many do. Dental, from what I've seen in the market, if you want to get dental on a Medicare supplement plan, it's almost all the time going to have a monthly cost associated with it. I do know of a few Medicare supplement insurance companies that will bundle in vision coverage at no additional cost or gym memberships at no additional cost. But once again, that's not all insurance companies. That's definitely not most. So if you want to keep a Medicare supplement plan, but look at getting a few extra benefits, not all of them, there are definitely some options, and you can give us a call and we'll chat about it. And actually, just alluding to it now, next week, our expert Alex Sampson will be talking about Medicare supplement plans versus Medicare Advantage plans. And I'm sure he's going to hit on that exact topic next month on the 15th. Barb has a question. I like our coverage with G, but I am concerned about not having dental coverage. I'm not interested in other extra advantage coverage. Okay. If you have a Medicare supplement plan and you want extra coverage like dental, you can definitely get it, and we can definitely help. There are individual dental plans that you can purchase in the market or through the insurance company you have, your Medicare supplement insurance company if they offer it. It's usually, like I said, going to have a monthly cost, but it is always important to keep track of your dental health, your vision health. You want to make sure that you're taking care of your whole body. So, Barb, if that's something that you're interested in, which is keeping your Medicare supplement plan while tacking on some of these extra benefits, we can definitely chat about that, and that is definitely an option for you. And if you have any other Medicare questions, give us a call and we will help you out. That is it for today. I want to thank you guys for the fun questions and staying tuned through the very end. We did cover a lot, so keep in mind that Mastering Medicare will be going on for the next few months, and we have another episode coming in live on October 15th with Alex Sampson from our office. He will be talking about Medicare supplement plans versus Medicare Advantage plans. We also have some in-person events that our office is hosting throughout Northern Nevada, and if you'd like to come learn about different Medicare plans in the area, you can come in person and watch us talk about these plans so you can learn more. If you want to get a full listing of the schedule of topics, dates, and times, click on the link in the description below, and it'll take you to our seminars page on our website. Once again, the annual enrollment period starts next month on October 15th, the same day that Alex Sampson is going live with his Mastering Medicare event. If you guys ever have questions or want to schedule an appointment, give us a call, or stay tuned until next month where we teach you more about Mastering Medicare. Have a great day.